Should we get started?
Sure.
Well, great. I really want to thank you for being here today. I'm really looking forward to our conversation. I'm humbled and honored to be the new CEO and president of the Guthrie Clinic. It has been an incredible journey and opportunity and a fantastic health system that I've been privileged to join. I want to thank the Guthrie team, and I want to thank our local community for just the hospitality that they've shown me and my family. My wife and I have moved here, and we're really excited to be living in the Valley and to make this our home. My background, perhaps we could talk about a little bit, just so as a matter of introduction. I'm a surgeon, background as a urologic surgeon. I have been practicing for well over 20 years. Started my career in the Air Force. Progressed through Air Force medical leadership and was honored to be their chief of staff of the largest hospital in the Air Force, as well as the leader of both the urology department and the clinical operations for part of the Air Force. I was then recruited to join the Cleveland Clinic after a 21-year career in the Air Force. At the Cleveland Clinic, I moved and became the president of the Cleveland Clinic Ohio hospitals, and so had a great deal of privilege to work in that setting. And now was very excited to be recruited to the Guthrie Clinic to be their new CEO and president. Guthrie Clinic is an amazing place, and I'm so excited to be here. As we look at our opportunities, we do it in the context of a 110-year legacy of outstanding clinical care, of an organization that has three missions. Missions to take care of clinical care of our patients, to provide groundbreaking research, and to educate the next generation for our future. So very, very inspiring. Guthrie is a regional and national leader, both in clinical care and in innovation. They are one of just a very few organizations in the country that have been recognized for 2 straight years as the top end of utilization of technology such as electronic medical records. So an amazing group of people, amazing hospitality, exciting times ahead. My goals for Guthrie Clinic and our team are to continue to have an unwavering focus on quality, safety, and experience, so that everyone as a patient can expect at any of our sites across the states that we are providing the highest quality care and the best experience. We owe that to our community, we owe that to our caregivers, and we owe it to each other. So we will be working very hard to ensure that. We need to expand so that we can serve more patients and provide them the quality of care that Guthrie is known for. So we will be looking to expand. As you may know, we are expanding into Ithaca, a new medical office building, and we are also expanding in Cortland with a new cancer center. This is the beginning of a great deal of expansion that Guthrie is anticipating and planning, and we're very excited about the future. At the end of the day, though, Guthrie Clinic is about our caregivers. All of us as employees are caregivers. No matter what we do, we're contributing to the care of a patient in some way. We want to be the destination employer for the entire region. So we work very hard to have top-tier compensation programs, opportunities for growth for all of our employees, as they are key to our success in the past and in the future. So with that, I'd like to take any questions you have, and again, thank you for being here today.
Sure, I guess I'll go first. I guess kind of what is your first plan of action, I guess, as president and CEO?
Yeah, thank you for that question. So our initially, of course, I'm getting to know everybody. I will be visiting all of the sites in our system. spending really quality time in what we call our listening tour, where really understand every aspect of our care. After that, our team is going to come together and really develop our strategic focus for the future. I can tell you, though, it will involve several features. It will involve a laser focus on safety, quality, and experience. We have historically been the best, and we will continue to focus on that so that at all of our sites you have the same level of quality, safety, experience. The second will be to expand the services we offer so that we are serving more patients than we are able to today. So that will be a big part of our future, both in recruiting, developing new services that we offer for patients, and really moving in that direction. In addition to that, we're going to work to transform care, right? Our goal is to improve upon what you see as a patient. And what that means is we want more care at home. We're really going to work to take care and move it from hospitals out to the outpatient setting, and eventually where we all want to get our care, which is in our own home. So we're going to work really hard to provide new styles of care that let us take care of people at home.
What brought you, you were at the Cleveland Clinic, right?
Yes.
Okay, what brought you to Sayre, Pennsylvania?
Um,
what was the, I mean, Guthrie has grown quite a bit over the last 10, 15 years. What was it that brought you to the small little town of Sayre?
So I will tell you, a couple of things come to mind. For my entire career, I had known about the Guthrie Clinic. Guthrie Clinic's legacy in patient-centered care, 110 years that this group has been doing this. And it's always been about the patient, it's been about the community. And I found that extraordinarily inviting. I see a tremendous opportunity for us to expand and to provide for even more patients. I really like the community. I had a number of visits here. I really find it, my wife and I have found it so inviting and so welcoming that we are extraordinarily excited to be here. I think the sky is the limit for the Guthrie Clinic. We have tremendous growth and service opportunities, and this community's been very welcoming.
Great, thanks.
Thank you.
Now, in terms of like a COVID-19 plan of action, what do you kind of have in mind going forward?
So we will continue to provide top quality care to our patients, both inpatient and outpatient. We are committed to that. Our outcomes have been excellent for the clinical care we've provided, and at this point we've treated almost 10,000 patients between inpatient and outpatient care, and we will continue to be open, available, and state-of-the-art for care of COVID patients. Great.
Anything else you'd like to add?
Well, I just want to thank you, and I look forward to getting to know you and to getting to know the community. Yeah, please.
Yeah, so you were kind of talking about the Cleveland Clinic and how you went there. What skills from the Cleveland Clinic do you think are directly going to translate over to helping you be the president here at Guthrie?
Well, as Guthrie, the Cleveland Clinic is a multi-hospital system. It's a physician-led organization, and it is a clinically integrated network. And that's exactly what Guthrie has as well. So I'm going to work very hard with our team to expand our clinically integrated network out so that we cover more people. We're going to work on patient experience so that anywhere you go in our system, you have that same seamless quality. You know you're in a Guthrie system. You know you can expect the best care. And that's what we're going to go after everywhere, every time.